Good afternoon. Today we will be speaking about nursing retention. This presentation will be performed by Jessica Seitz, Daniel Lewis, and Michael Wilson. Roughly 40% of the nearly 3 million registered nurses in the United States have an associate's degree as their highest level of nursing education. Yet before the recent Institute of Medicine report on the future of nursing, employers of RNs have increasingly preferred BSN over ADN. Data from the American Community Survey were analyzed in respect for employment setting, earnings, employment outcomes of ADN and BSN prepared RNs. The data revealed a divergence in the employment setting. The percentage of ADN prepared RNs employed in the hospital dropped from 65% to 60%, while the percentage of BSN prepared nurses grew from 67% to 72% over this period. Many ADNs who would have otherwise been employed in hospital settings seem to have shifted to long-term care settings, same with LPNs. Ultimately, a robust, integrated, and complex, efficient healthcare system requires a diverse nursing workforce, and the schools that pair these nurses need to anticipate these skills and competencies for these nurses. The IOM set a goal of 80% of newly graduating RNs having a BSN by 2020. This call has been suggested to be prepared at the BSN level for increasing complexity of care. For decades, RNs have prepared via three ways. You have a 2-year associate's degree program, a 3-year hospital-based diploma program, and a 4-year BSN program. The diploma programs have pretty much disappeared, leaving roughly equal amounts of RNs obtaining their initial preparation towards ADN and BSNs. Between 05 and 08, there were approximately 3% prepared via a diploma program, 5% via an ADN, or 57% via an ADN, and 40% via a BSN. Not apparent in those figures, however, is the shift from basic nursing education away from the ADN towards the BSN. Beginning about 10 years ago, the Nursing Credentialing Center began designating hospitals like magnet institutions based on certain quality and other benchmarks, one of which is that by January 2011, 75% of nursing managers would have a bachelor's degree. Then building on a series of research studies over the last decade, indicated the risk of inpatient mortality is lowered in hospitals employing a greater share of bachelor's nurses. The Institute of Medicine recommended 80% of the RNs be prepared at the BSN level by 2020. States and institutions appear to have taken up this call, and by 2014, 80% of California hospitals required an RN staff to have a BSN. Recent comparisons of roughly 1,000 newly licensed nursing graduates found that 82% of new BSN graduates were employed within 18 months of graduation, compared to 67% of ADNs. That is the end of my part. Next up will be Jessica Sykes.